when you're pregnant, you shouldn't take drugs anyhow. Always check with your doctor before you take any drugs. What's up, beautiful people? Welcome to another exciting episode of TTC Diaries with Dr. O, you already know. And today I'm coming at you with another interesting topic. So let me first of all say that this topic is something that is very, very important for all women that are trying to conceive. And in fact, it can be something very devastating, because in some cases for a lot of women, it's not that they can't get pregnant per se, but they get pregnant and they keep having miscarriages, right? And miscarriages can be so devastating, it can be so heartbreaking, and a lot of women don't get over it immediately. It can cause a lot of psychological trauma, right? So today we want to discuss some of the things that could possibly cause you to have a miscarriage, so you know any avoidable factors, you can avoid them, and those that you can't avoid, you can aware and know that this is not my fault, there was nothing I could have done to change this, right? And maybe that might help you to move on a bit more, because women that go through miscarriages, part of the reasons why they're not able to get over it soon is the fact that they keep blaming themselves for the miscarriage. Or maybe it was something I did, maybe I stressed myself too much, maybe I took something I wasn't supposed to take, all those kind of things, right? Meanwhile, more than 50% of the time, a miscarriage has nothing to do with the woman. It's not the woman's fault, it's nobody's fault, it just happens. And I'm going to explain why in just a minute. So the first reason why people have miscarriages, right, is something that we call chromosomal abnormality. So chromosome, this has to do with genetics. It has to do with the genetic makeup of a person, right? So I'm not talking about genetic makeup of the parents, right? This time we're dealing with the embryo. So more than 50% of miscarriages happen due to chromosomal problems. If there's any problem with the chromosomes, or if the fertilized egg is not developing like the way it should, right, the body will automatically get rid of that pregnancy, because if the pregnancy should go ahead, probably the baby might die in the womb, the baby might die after birth, or the baby might come out, with various type of birth defects, right? So when the body detects those kind of chromosomal abnormalities, in order to save parents distress and trauma, it automatically gets rid of the pregnancy on its own. So more than 50% of miscarriages happen due to these chromosomal abnormalities. The body is just helping you to get rid of what it feels like might not turn out to be a normal baby, might not turn out to be a healthy baby, or the baby might not thrive if born. So that's one of the common reasons. So always remember that if you have a miscarriage and all the other reasons I'm about to mention don't apply to you, then remember that, see, my body is helping me to get rid of this pregnancy so I can have a better baby, right? If this baby is born, maybe the baby would, bring a lot of stress, a lot of strain on the family, because we have to be caring for the child, you might spend extra money and all that. So your body is just helping you to get rid of the baby so you can have a chance at getting a normal baby. So maybe this can be a form of consolation to some women that had miscarriages in the past, that, okay, if this baby had been born, the baby might have caused more harm than good in this family. So maybe it's okay that I had this miscarriage. At least I have another chance to do it all over again. So the next common reason why women have miscarriages is cervical abnormality. So for example, cervical incompetence. So cervical incompetence, let me flash back and explain, although I already explained this in some of my videos. The cervix, like I said, is the neck or the entrance of the womb. So this is your cervix closing the womb, and this is your womb sitting just above the cervix, right? So the cervix basically closes the womb. So basically, the womb is supposed to stay closed throughout your pregnancy, right? And the only time your cervix should be opening up is when you are in labor, when it's time for you to give birth to the baby. If your cervix opens up any time before you are supposed to go into labor, then we're talking about preterm labor. We're talking about premature birth of the baby, and we definitely don't want that. And preterm labor and premature birth is even when the pregnancy is a bit advanced. If the cervix opens up early, much earlier in your pregnancy, say like early second trimester or so, then we're talking about a miscarriage, right? And in cervical incompetence, women that have cervical incompetence, it means that their cervix is not able to stay closed throughout the pregnancy to keep the pregnancy until labor, right? So before you get to full term, which is around 40 weeks or 30 something weeks at least, your cervix starts to open up. And what will happen when your cervix opens up? You're going to have a miscarriage. You're going to lose the pregnancy. If you have or you've been diagnosed with cervical incompetence, then it's a good idea, right, in your next pregnancy, immediately you get to know you are pregnant, by the end of your first trimester, the doctor is going to do something called a cervical cerclage, where they put in stitches to hold the cervix close till you go into labor or till it's time for you to put to bed. So it's very important that if you've ever been diagnosed with this condition, you are aware, so that in your next pregnancy a miscarriage doesn't happen again. So bear in mind that if you've gone through a miscarriage, of course, one of the things you want to know is, why did I have a miscarriage? So you want to be asking your doctor, what could have possibly caused this? If your doctor feels or noted that you have a cervical incompetence, they would mention it to you, oh, that this was why you had it. You have cervical incompetence, blah, 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 blah. And they will advise you on what to do next, which is come earlier in your next pregnancy so we can put in a cerclage for you. Of course, I'm not saying every woman that had a miscarriage was the miscarriage happened as a result of cervical incompetence. No, this just happens to some women. Some of you may be wondering that, okay, why would someone have cervical incompetence? For some people, it just happens. For others, as a result of different procedures that they've gone through. Maybe they had any surgery to the cervical area, or any surgery that required entrance to the womb, or things like that. Or maybe in some people, multiple termination of pregnancy is also known as abortion. That could also lead to cervical incompetence. So I'm not saying everyone that has cervical incompetence has had an abortion before. Like I said, I mentioned other reasons why you could have cervical incompetence. Termination of pregnancies and abortions is just one of them. Then the next common reason why women have miscarriages is something that we call hormonal imbalance or hormonal irregularities. So in order to keep the pregnancy till full term, there are certain hormones that play a role. So we have your estrogen, we have your progesterone. The right balance of all these hormones have to be present in order to keep the pregnancy, right? So in most women that have miscarriages, especially in the first trimester, they normally have low amount of progesterone. That's why every time someone has recurrent miscarriages and you go to the doctor and they don't find any other cause, they'll put you on progesterone therapy, right? So that you can boost your progesterone hormones, and throughout your first trimester you remain on progesterone. If someone is at risk of a threatened miscarriage, that kind of thing, they put them on progesterone therapy throughout the first trimester so that they don't have any miscarriages. So it's very important that if you had a miscarriage before, you want to find out from your doctor, did I have any hormonal irregularities, that kind of thing. If they suspect you did, or if they checked and found that you did, then your next pregnancy is a good idea to start visit the doctor immediately. Start your antenatal clinics as soon as possible, so that if you need to be placed on progesterone therapy, the doctor will do that for you to prevent another miscarriage. The next reason why women experience miscarriage, now this is not common among all women, but there are actually some women that fall into this category, right? And this is smoking, taking alcohol, and using illicit drugs. Alcohol, cigarette smoke, illicit drugs, cocaine, all these other drugs, they are harmful for your baby. They're harmful for the pregnancy. There are so many complications that can happen as a result of you taking alcohol, you smoking, you using these drugs in pregnancy, and one of them is miscarriage. It could lead to a miscarriage. Please, please, and please, if you're the kind of person that likes to take a sip of wine here and there, or you like drinking your beer or whatever it is, when you are pregnant, you need to stop it, okay? It's just for 9 months. Stop it, because it's not healthy for you, it's not healthy for your baby, and it could lead to a miscarriage. So you have to keep this in mind. So, like I said earlier, there are many reasons why people have miscarriage. There's so many reasons, but I'm only talking about the common ones. And the last one I want to talk about today is drugs or medication. So this time I'm not talking about illicit drugs, recreational drugs. I'm actually talking about prescription medication. So there are actually some drugs that you take that might be harmful for your pregnancy, right? So there's different ways in which drugs can be harmful for your pregnancy. Remember that when you're pregnant, you shouldn't take drugs anyhow. Always check with your doctor before you take any drugs, because one of the things that drugs could do is they could harm your baby. So in development, so you see some babies that are born with deformed limbs or things like that, is because their moms took certain drugs that they were not meant to take during pregnancy. And there are so many other birth defects that could result from taking drugs that are harmful for your baby. You might innocently take those drugs. Some of them might be antibiotics, right? You're thinking, oh, I want to treat infection, but at the same time you're causing harm for your baby. That's why when you're pregnant, always check with your doctor before taking any drugs, and do not take any drugs without prescription. In case your pregnancy is not obvious, whenever your doctor prescribes medication for you, ask, let the doctor know, hey, I'm pregnant. Is it okay to take this while pregnant? So that your doctor can double check and make sure that it is safe for your baby, right? Because some drugs, one of the complications is miscarriages. One of these drugs is this isotretinoin that is used to treat acne. So in your mind, you're thinking, oh, I'm just taking this drug so my acne will go away, but you don't know you're harming your baby. So be careful whenever you take drugs during pregnancy. This is very important. Lastly, I want to say, if you've ever experienced a miscarriage, if you've been through a miscarriage, don't worry. there's always another chance to have another baby. Okay, don't be too hard on yourself. It's not something you did. Let me mention that some of the things that do not cause a miscarriage, because there's a lot of misconception about what causes miscarriage. A lot of people don't even know that these things that I mentioned do cause miscarriages, but there are some things that actually do not cause miscarriages. One of them is stress. There's this misconception that, oh, she's stressed, that's why she had a miscarriage. Miscarriages are not caused by stress. Yes, stress is not good for pregnant women, but it would not lead to a miscarriage. Another thing that does not cause miscarriages is exercising, right? Regular exercising like jogging and all those things. They don't cause miscarriages, right? So do not think that, oh, because I am pregnant, I shouldn't do exercise. Pregnant women should actually do exercise to stay fit, but don't do anything strenuous, right? Don't do anything that could harm the baby, in terms of maybe you fall down or something and it leads to trauma and then you start having placental abruption or something. No, we don't want anything like that. Do light, moderate exercise, but you should be exercising. So exercise will not cause a miscarriage. And the last thing that people think could cause a miscarriage, which doesn't, and which I think I've addressed in my video where I talked about, is it safe to have sexual intercourse in pregnancy? Is sexual intercourse. Having sexual intercourse in pregnancy does not lead to a miscarriage. So please don't deprive your spouse of sexual intercourse or vice versa, right? If your spouse is depriving you because they think that you might have a miscarriage, then you need to show them this video when you get pregnant, okay? So yeah, like I was saying, if you've ever had a miscarriage, please don't be hard on yourself. You're going to have another baby very soon. But the most important thing is that if the miscarriage was caused by something that could be avoidable, like cervical incompetence, taking medications, right, hormonal irregularities, then you want to make sure that immediately you get pregnant next time, you tackle it, right? Go see a doctor immediately so any of these issues can be tackled, and don't take any medication that has not been prescribed. If you enjoyed watching this video so far, don't forget to click the like button, subscribe, and share with anyone you think might need to see this. Remember, you are not alone on this journey to pregnancy. Just keep your eyes on the prize and your baby will be here sooner than you think. See you next week.